Hello, my name is Alan Owens. I'm with HapTics Professional Massage Center located here in the metro area of Oklahoma City. Today we're going to talk about the difference between HapTics and chiropractic services. People have asked me over the years, can you better explain to me the difference between what I do and what chiropractic does? So today we're going to go over some bullet points of what this video consists of, and we'll follow along, and hopefully it'll be informative. By the end of the video you should have a good understanding the difference between what I do, body alignment therapy, and what chiropractic does. Muscles, ligaments, tendons, and connective tissue are what pulls the bone structure out of alignment. So if a chiropractor has you in there for 5 minutes and makes the adjustment, it may feel good at first, but then it inevitably comes right back again simply because the muscles need to be loosened up. In this video you'll see a chiropractor from Houston. I have a tremendous amount of respect for him. I mean, I was watching his videos. The guy's been doing business for 30 years. He has some really interesting techniques, rather aggressive, which I like. I mean, that's great. But this particular female that he has coming in has issues I truly believe are her thigh muscles, psoas muscle, and iliacus muscle. That's what's pulling her body forward. So this chiropractor places her face down on the table and starts using his elbows to get deeper stretch in the body. So he understands that the muscle is the problem, but he's not going to tell her to go get muscle work done and then come back and get work done. He lays the lady down and he works on her, and he goes from his hands, all right, then he goes to a bigger tool, which is his elbow, and then he actually goes to a tool.
We have Anna Marie here with us today. And as you can see, Anna Marie has a severe antalgic posture leaning way forward because severe low back pain and sacroiliac pain that's actually shooting down both legs all the way into her ankles. Joint first. Okay. Oblique stretches in her spine right now because of the muscle spasms. So I'm putting some really deep pressure with my elbow into her paraspinal muscles in her lumbar spine and also down in her sacroiliac joint here. It's very painful, huh?
Most chiropractors, they are not muscle people, they are bone people, but they know the muscles pulling that bone structure out of alignment.
We're going to recommend in week 1 3 visits right through that first month of care for a total of 12 visits in month 1. Month 2 we're going to recommend 8 visits twice a week each week. Month 3 we're going to recommend 2 visits in the first 2 weeks each week, and then in the second 2 we're going to go to 1 visit in each week. And then in month 4 we're going to recommend 2 visits in the front, and we're going to start to scale down and head toward wellness care. Plan, remember, is 29 visits at $45 a piece for $1,305. When pain decreases and financial pressures increase. At the same time pain is going down, financial pressures are ratcheting up. My attorney likes to call this the keys, shoes, and belt moment. He says nobody who ever calls him up at 3 o'clock in the morning who's been pulled over by the police only to find out that he's had a couple too many drinks and now he's in the slammer and waiting for his lawyer and his one phone call. He says none of his clients ever call him up and ask, What's your fee? How much does this cost? Let's negotiate about the price of getting me out of here. No, they're in their, what he calls their keys, shoes, and belt moment, and they don't care what it costs. They want out. And we have those too as well, right? We have their key, shoes, and belt moment when people walk into our office and they're in a lot of pain and they're having that key, shoes, and belt moment and they say, Doc, I don't care who, what, where, you tell me what I got to do. I'll stand on my head. Just get this feeling of a knife out of my back. That's a key, shoes, and belt moment. We have them. Patients are highly motivated during them, but if we're leading them properly,
If you take a chiropractic visit that's typically 5 minutes and you go to massage therapy where their typical session is an hour, how do you not see a difference? My sessions are 45 minutes long and I make a tremendous difference in people, as this video will show. It's very important to understand that the muscles are supported by the bone structure, but the bone structure can only move if muscles, ligaments, tendons, and connective tissue move the bone structure. If they have the ability to move the bone structure, they have the ability to pull the bone structure out of alignment. If you're taking muscle, ligaments, tendons, and connective tissue and forcing that stuff back into alignment so that you can get the bone structure to line up, how long is that going to last? please stay tuned to the end of the video and watch Carl Holmquist talk about his chiropractic book and CD. He is the only one that I have ever come across that actually shows you the correct way to provide your family with pain relief utilizing chiropractic techniques. These techniques are meant to be very simple. How he explains his mindset of how chiropractic has evolved and how it continues to evolve. Keep in mind, this video was done roughly about 32 years ago and nothing has changed. If anything, it's gotten more high speed when it comes to chiropractic services in general, and they get you in and out these offices rather quickly, and a lot of times people don't get the relief they need to have. Bottom line is, you need to have the muscles, ligaments, tendons, and connective tissue addressed in order to get the skeletal structure back into alignment.
Hi, I'm Dr. Carl Holmquist, a practicing chiropractor in Forks, Washington, and author of the Home Chiropractic Handbook. My book was first published in 1985. Since then, I have received numerous requests to produce this video. My book and video is the first presentation of chiropractic for the family that can be applied at home. If everyone could afford professional chiropractic maintenance care, there would be no need for my book or video. However, that's not the case. There has been a long-standing need for home chiropractic, as people have sensed that chiropractic is basically simple. One thing I'm sure of, I know I can convey the simplicity and the beauty of the chiropractic philosophy, science, and art to you. I'm the fourth chiropractor in my family to have graduated from Palmer College of Chiropractic in Davenport, Iowa. In my opinion, medicine is a multi-billion-dollar industry dedicated to keeping the public drugged. They don't want you to ask, why are you sick? Just take something. Don't ask, why do you have stomach problems? Why are you constipated? Why is your heart not working right? Why is your gallbladder not working right? Why do you have headaches? Why do you get colds all the time? Don't ask why. Just take pills. Got kidney problems? Take kidney pills. And they want you to believe that the kidney medicine you're taking goes only to your kidneys. Now, my friends, as a fact, your heart pumps that drug through your circulatory system to every organ, every tissue, every cell in your body. Your brain is going to get those kidney pills. Folks, it's my opinion that 90% of the medical system of health care has become a racket. Unfortunately, ever since chiropractors got to carve up a slice of the medical insurance pie, 90% of it has become a racket, in my opinion, as well. Except instead of sending you to the drugstore endlessly, chiropractors adjust their patients every day for 6 months, 3 times a week for the next 6 months, etc., as long as the patient has insurance. And of course, you know what happens if you use your insurance too much, especially for maintenance care. I guess what happened, in order to carve up a piece of the medical pie, chiropractors felt they had to try to be like medical doctors. And so now many chiropractic colleges teach all sorts of medical courses. Why a chiropractor needs training in giving vaginal or proctological exams in college is beyond me. You see today chiropractors wearing stethoscopes around their necks, taking blood pressure. I guess to feel like real doctors. I never needed my blood pressure checked. If someone did need a blood pressure check, let the medics do that. If chiropractors remain true to the great principles of chiropractic, by now the chiropractic profession would be 10 times the size of the medical profession. With chiropractors charging people for back rubs, ultrasound, diathermy, vibration of muscles, sinus rubs, blood pressure checks, colonic irrigations, acupuncture, acupressure, traction, minor surgery, and medical exams in some states, and a host of other modalities, remedies, and cures, all under the name of chiropractic. No wonder people are confused, and no wonder the profession hasn't grown to be the largest health profession. Not that I'm against traction or all these methods, it's just not chiropractic, not what chiropractors should be doing. The feeling that I have that 90% of the major health professions are a racket and waxing fat on the masses is a feeling felt by lots of people. So I figure I can balance this problem by giving chiropractic directly to the family. Besides, chiropractic is simple. D.D. Palmer, who discovered and founded chiropractic, said so himself. And considering the men and women who studied from him for just a few days and without x-rays and all that sophisticated bull that modern chiropractors use, they went out and literally built the profession. It exists today because those early chiropractors got results, got people well. with simple tables using just their hands. Chiropractic is simple. I'm going to quote from the only book ever written by Daniel David Palmer, the founder of chiropractic, entitled The Science, Art, and Philosophy of Chiropractic, published in 1910. Incidentally, I'll bet my bottom dollar that a student today in any chiropractic college will not be able to find a copy of this book in his college library or anywhere else, even though it was written by the founder of chiropractic. You'll see why, folks. Modern chiropractors don't want this book out there. However, let me emphasize that it is well worth the effort to find a good, principled, professional chiropractor for your family, even if you have to travel a great distance once in a while. Your family will need this chiropractor for all serious spinal injuries, severe pain, and more complicated health problems. So I'm encouraging you to find a good professional chiropractor. And unless their ego is so fat, I feel certain he or she will be willing to help your family with home chiropractic.